Hi, welcome to the channel and welcome to another anatomy video. Today we're going to start with our series on the autonomic nervous system. The first video, or rather this video, would be introductory and would give you the general idea behind the structure of this system. Now, you know that autonomic systems, or the autonomic system, is divided into two major functional subsystems, and that's the sympathetic and the parasympathetic autonomic system. Now, the sympathetic autonomic system is the one that's responsible for the fight or flight response, and the parasympathetic, it's usually concerned with the rest and digest, something basically when you are in a resting position. Now, they do have some similarities, and of course, since they have different functions, they must have some differences. The similarities is that both of them are comprised of two neurons, a first-order neuron or preganglionic neuron and a second-order neuron or postganglionic neuron. They are called pre- and postganglionic because these first-order neurons are usually located, not usually, are located in the central nervous system, while the postganglionic neurons are located in the peripheral nervous system where they make ganglia. And these ganglia are the so-called autonomic ganglia. And the fibers arising from the autonomic ganglia are the postganglionic fibers. If you have a synapse that's in between a sympathetic preganglionic neuron and postganglionic neuron, that's a sympathetic ganglion. And if in the ganglion we have the bodies of the postganglionic parasympathetic fibers, these are the parasympathetic ganglia. In general, these are the main similarities. In both cases, also something else, in both cases the preganglionic fibers use acetylcholine as neurotransmitter, and both of them are myelinated, while the postganglionic fibers are non-myelinated. And these are the similarities between the two systems. The differences come with several things. First of all, the position of the postganglionic fibers in the parasympathetic system is very close to the organ or in the organ themselves, and these are the so-called para-organ or inter-organ ganglia. While the sympathetic system has ganglia which are very close to the origin of the preganglionic fibers, and these are the so-called paravertebral or prevertebral ganglia that we'll discuss a bit later. The other difference is that parasympathetic use acetylcholine as neurotransmitter in the post, while sympathetic can use acetylcholine if innervating glands, but mostly also uses norepinephrine and epinephrine as neurotransmitters. Now, keep in mind when we say neurotransmitters, these guys do not make synapses in the general idea of synapse. They rather make these elongated varicosities like bubbles of the axon, which have a storage of synaptic vesicles and secrete the neurotransmitter in the general vicinity of the design target. Okay, and the last difference is the way they react. You can see you have a very small divergence in the parasympathetic system. You have one neuron preganglionic contacting around 3-ish, while the sympathetic has one preganglionic contacting around 30-ish, could reach to 100 or 200. What does this divergence mean? Divergence means that one neuron from here can excite over 30 from here, and these 30 neurons can cover a much larger area of the organ, while this one has a much smaller divergence, so one neuron from here can cover a much smaller area from the organ at the end. Why is this important? Well, I suppose that if you think about it, I suppose that you would realize that when you're resting and digesting, you don't really need to be very fast with your response, and you could afford to be more precise. While if you try to escape a lion which has ambushed you, you just want to get the hell out of there, and you don't really care about how precise you are with the response. You just need a very fast response that covers everything, and you don't waste time. Now, we said the other difference is in the location. We said the preganglionic fibers arise from the CNS. Now, if you imagine your CNS like this long cord here with the forebrain, brainstem, and the subdivisions of the spinal cord, cervical, thoracal, lumbar, sacral, coccygeal, sorry, you would see that you have sympathetic system only in the thoracal, to the beginning, the sacral region, T1, L2, while the parasympathetic system arises from the nuclei of the brainstem, some of the nuclei of the brainstem, and as well from the sacral portion of the spinal cord. So we have this cranial and sacral parasympathetic portions, and this is where they would originate from. Now let's cover each one of those, at least the general principles. This is again more of a introductory video. We'll have separate videos to go more in depth for every one of those systems. Okay, so you do know how a spinal cord looks like, with the dorsal horn and the ventral horn, motor, sensory, but at some levels they also have this lateral bulge here, which is called the lateral horn. And why is that important? It's because the sympathetic system starts from here. So you have this lateral horn only at the levels where we have the thoracal, actually only at the levels of the thoracal beginning of lumbar region, because this is the origin of the sympathetic system. From here, these fibers would join the spinal cord nerves and synapse with one of the ganglia of the so-called sympathetic trunk. These ganglia are also called paravertebral ganglia or chain ganglia. Why? Because each ganglion is interconnected with the others by these communicating branches here. The dot signifies that I just didn't draw all of the nerves, but in general you have 3 cervical ganglia, you have 10, 12 thoracal, you have 3-ish, 4-ish lumbar, and 4-ish pelvic. You also have one ganglion which is called ganglio impar in the middle, which is not represented here. But in general, this would be like a long chain of ganglia which are like a beads on a string thing, right? Very easy to imagine, I suppose, and very nice to see during your dissections. The best representation is usually in the cervical region, or in the lumbar is also very nicely represented most of the times. Okay, so you have this chain ganglia of the parasympathetic trunk. What happens? The preganglionic fibers can come, synapse here, and these postganglionic fibers now need to reach their target. First of all, they can do it by tagging along again with the spinal nerves. So what would happen here? We have a branch of the spinal nerve which branches off, goes to the ganglion, then branches off again and goes to the nerve again. And these are the so-called communicating branches. Since the preganglionic are myelinated, the preganglionic communicating branches are called wide communicating branches, which go to the ganglia synapse, and after the synapse, the postganglionic fibers, which are non-myelinated, would go back, branch again from the ganglion, and again join the spinal nerve, and they're called the gray communicating branches because you don't have myelin, meaning they wouldn't be so whitish in color. Okay, so that's one of the things they can do. The other thing that the other way they're able to reach their target is through the blood vessels. Now what happens there? You can get these fibers communicating with, of course, the cells of the ganglia of the sympathetic trunk, and these cells would after that go and join to the artery, forming a plexus, a nervous plexus around the artery, and this nervous plexus would follow the artery and reach the desired target. For example, this first ganglion, which is the highest ganglion, sympathetic ganglion that exists, is located around the angle of the mandible, around C4, for example. And you need to innervate the entire head, right? You have nasal mucosa, you have palatal mucosa, you have eyes, which also have some innervation. So how do they reach these head targets? by tagging along with the internal and external not mesenteric, internal and external carotid arteries and branching off at their corresponding levels. So this is one of the other way they usually use to reach the targets of they desire. Now, why are those ganglia called chain ganglia, and why do you need these interconnected loops here? Mainly because these guys are found only from T1 to L2. Meaning, if you're a ganglion which is located high in the neck at the level of C3, for example, you don't have any nearby spinal nerves for you to get innervation from, right? So what these fibers do is they go to the corresponding, let's say TH1 would go to the ganglion at located near TH1 nerve, and then like that they can omit synapsing, right? They can just go through the ganglion. They can go through this communicating branch of the chain ganglia and reach an upper ganglion and synapse there, which is why these ganglia are so interconnected by these chain side communicating branches. Now, these are the two options that the postganglionic fibers of the sympathetic trunk have, but the preganglionic fibers can have other targets. We did say that one of the major ganglionic systems of the parasympathetic sympathetic system is the sympathetic trunk, but the sympathetic system also has another set of ganglia which are located around the blood vessels, usually around in front of the vertebral column, and these ganglia are called the prevertebral ganglia. So what happens is the preganglionic fibers just go through the ganglion, they don't synapse, they branch off, they reach the prevertebral ganglia, and then synapse there. Now, these prevertebral ganglia are actually not located just in front of the vertebra itself, they are located in front of the abdominal aorta. And you have 4 sets of them. Ganglia around the celiac trunk are called celiac ganglia. Ganglia around the superior mesenteric are called superior mesenteric ganglia. Around the inferior mesenteric, I guess you already know, inferior mesenteric ganglia. And around the transition between aorta and renal arteries, they're called aortico-renal ganglia. These are usually 2. This is usually 1 behind the mesenteric artery. These are usually like 3-ish smaller ganglia around the mesenteric artery, the inferior one at least. So from here, they go to these cells, they synapse there, and again, they would make a lot of plexi around these vasculatures here, because the easiest way to reach the abdominal organs is usually through the blood vessels. So you would have the celiac plexus, you would have the inferior mesenteric plexus, the superior mesenteric plexus, the renal plexus, etc., right? The common iliac artery, etc., etc. The 2 major plexi which are not named after an artery are the superior and inferior hypogastric plexus, which are located around the sacral bone and at the promontorium. So this is number 3, right? They can go to the prevertebral ganglia. And number 4, as an option for a way of these guys to reach somewhere, is they can reach the adrenal glands directly. Now, this is one of the reasons why you have so fast response so not fast, but also generalized response of the sympathetic system, because they innervate the adrenal glands and stimulate the release of epinephrine or adrenaline, depending on which country you're listening this from. Right, they're the same molecule, and by hormones they can affect very fast the whole body. But you would see here that something interesting happens. You have preganglionic, postganglionic, preganglionic, postganglionic, right? You also always have preganglionic, postganglionic. You have preganglionic, but you kind of don't have postganglionic fibers. Why is that? Well, the reason is you do have postganglionic fibers actually, and these are the neuroendocrine cells of the adrenal glands. The adrenal glands is basically a sympathetic ganglion which has evolved during time to become this endocrine gland. So basically, it's the gland itself is the postganglionic fiber, the postganglionic neuron. So if you have to summarize, the sympathetic nervous system has 4 major ways to affect the body: by the sympathetic trunk, which makes either plexi around the arteries or plexi or goes along with the spinal cord nerves, by the prevertebral ganglia around the mesenteric artery, or by the adrenal glands. And that's pretty much the overview of the sympathetic nervous system. Now, going towards the parasympathetic nervous system, it's a little bit, at least for me, harder to represent, but because much drawing. But you do know that the parasympathetic nervous system, as we discussed, originates from the brainstem and from the sacral portion, S2, S4. Now, they would make ganglia, and of course, as the sympathetic system does, but these ganglia are solitary ganglia, they don't make chains, and they are located usually near the organ of interest. So, the major outputs of the cranial portion of the parasympathetic systems are the cranial nerves, and more precisely these 4 cranial nerves: oculomotor, facial, glossopharyngeal, vagus nerve. And these nerves sorry about that. And these nerves would make several very well studied ganglia. The oculomotor nerve, which have of course separate names, the oculomotor nerve forms the ciliary ganglion, which innervates the eye. The facial nerve, mainly the pupil and the ciliary muscle. The facial nerve, which makes the 2 more ganglia, which are the pterygopalatine and the submandibular ganglia. The pterygopalatine ganglion is responsible for innervating the nasal mucosa, palatine mucosa, and the tear gland, the lacrimal gland, while the submandibular ganglion is responsible for innervating the submandibular and sublingual glands. Now, some people do say that you could have a separate ganglion formed around the sublingual gland, which is called the sublingual ganglion, but it's variable, could be present, could not be present. Either way, to be honest, during your dissections, you would most likely never see the sublingual ganglia, the sublingual and submandibular ganglia, the only ones that could be demonstrated because they are easier to dissect. The others are very, how to put it, tedious. But the only one that you would be able to see is the ciliary ganglion next to the optic nerve and the pterygopalatine ganglion found in the pterygopalatine fossa. But either way, you should know that they do exist. The glossopharyngeal nerve innervates mostly the parotid gland and a little bit, of course, the inner ear, of course, at least mostly by the inner ear. It makes a plexus around or at least takes part in the plexus called plexus tympanicus, and innervates the mucosa of the inner ear. And the innervation of the parotid gland happens through a ganglion which is called the otic ganglion. Now, the vagus nerve does not form so well distinguished ganglia as these cranial nerves, but it usually forms ganglia which are located just near the organs it's going to innervate. And these are called usually bronchial ganglia, cardiac ganglia, right, etc. Renal ganglia, depending on where they're found. Again, it could also make ganglia inside of the wall of the organs, like inside the intestines, and these are called the inter-organ ganglia. And the ganglia that are near the organs, like the bronchial ganglia, are called the para-organ ganglia. The vagal nerve does have 2 more distinguished ganglia, which are called the jugal ganglion and the nodal ganglion. Just mentioning them here if you want to remember them for your information. And you can see that the vagus nerve has a very wide range, very wide range of innervation, right? It innervates the lungs, the bronchi, the esophagus, it innervates the lower part of the throat, it innervates liver, the digestive system, basically most of the organs, the digestive systems, kidneys, etc. The end of the innervation of the vagus nerve is around the left colical flexure, or kind of somewhere around the distal third of the transverse column. From here down, the innervation is taken on by the pelvic portion, by the sacral portion of the parasympathetic system. So the sacral portion would innervate the descending column, the sigmoid column, the rectum. It would innervate the internal genitalia like the uterus, the vagina, the prostate. It would also innervate the external genitalia, which I didn't draw here because reasons, etc. But how are they going to reach those targets? So in short, if you have to summarize, most of the innervation targets of the sacral portion are the pelvic organs, with the exception of the descending column, the sigmoid column, right? So how did they reach those targets? They form a plexus in front of the sacral bone, which is called the inferior hypogastric plexus, and from there, around this inferior hypogastric plexus of Gauss, you have your ganglia, your parasympathetic ganglia, and these parasympathetic ganglia are the so-called pelvic ganglia. Well, that's pretty much it. Something else that I forgot to mention is that these are the effector neurons, right? Basically, these are the motor neurons, or since they affect organs, they are also called visceromotor neurons. So this is the output. The sympathetic systems also have input, right? And this input would be coming from sensor from here back to the central nervous system, and these are the so-called viscerosensory organs. Now, one interesting thing is that these guys are very densely interconnected, and you could remove this sympathetic ganglia in several cases. At least I know of two. Since since this system is also viscerosensory, this is done usually in palliative care. If the patient has severe pain, you could remove the ganglia, remove the sympathetic plexus and ganglia, but that's not very successful all the time because they form this very dense plexi. They are very well interconnected, and not very often it won't work. The second reason I've heard is if you know what Raynaud's syndrome is, this is a disease, but not disease, a condition in which when exposed to cold, you get this very severe vasoconstriction, usually in the distal portion of your fingers, and they become basically pale white as they are completely devoid of blood. If this is very severe, it could be treated by, again, removing ganglia of the sympathetic trunk of the or not ganglia, but removing portions of the sympathetic system innervating the hands. But again, due to this very dense interconnection, it's around 30% of the time, as far as I know, the symptoms would reoccur, mainly because you have chain ganglia, you have fibers going up, going down, etc., etc. Okay, hope this was useful. Next, we're going to tackle each one of the parasympathetic ganglia one by one, and we're going to take a look at some point. If you want, of course, just drop it in the comments down below. The major plexi, the major vascular, not vascular, but plexi around the blood vessels of these systems. Hope the video was useful. If you like it, leave a comment, like it. If you dislike it, tell me why you dislike it so I can try and make it better. Until next time, have a good time.